Jessica stared at her phone screen in disbelief as her boyfriend Mark frantically typed another question into ChatGPT about his mother's deteriorating condition. For the third time that week, the AI was confirming exactly what Jessica had been telling them for days, advice that had been dismissed simply because it didn't come with a medical license attached to her name. For years of rigorous nursing education hadn't been wasted, even though Jessica had ultimately chosen a different career path and never took her board exams. The knowledge remained sharp, the instincts honed by countless hours studying pathophysiology, pharmacology, and patient care. But apparently, that meant nothing to Mark's family when his 68-year-old mother Helen was fighting for her life. It had started 3 weeks ago when Helen was diagnosed with heart failure. The angiogram revealed significant blockages, landing her in the ICU for a harrowing week that left the entire family shaken. Mark, usually calm and logical, had become a bundle of anxiety, frustrated by their cardiologist Dr. Martinez's apparent lack of communication. Instead of pressing the doctor for clearer explanations, something Jessica had repeatedly suggested, Mark had turned to artificial intelligence for medical guidance. "You're paying him thousands of dollars," Jessica had gently reminded Mark one evening as he scrolled through WebMD articles and ChatGPT responses. "A good doctor should welcome your questions. Don't be afraid to advocate for your mother." But Mark seemed more comfortable interrogating a computer program than challenging a medical professional with years of experience. The pattern was both heartbreaking and infuriating to watch. When Dr. Martinez discharged Helen just 3 days after her angioplasty, Jessica's internal alarms began sounding. The timeline felt rushed, the follow-up plan vague. Her nursing training had taught her that post-cardiac procedure patients needed careful monitoring, especially elderly women with Helen's complex medical history, including diabetes and hypertension. Within 48 hours, Jessica's fears materialized. Helen developed a persistent cough that echoed through the house, her ankles swelled like balloons, and she could barely walk to the bathroom without becoming breathless. Her blood sugar readings resembled a roller coaster, spiking and crashing unpredictably, while her blood pressure readings painted an equally chaotic picture. "This isn't normal recovery," Jessica told Mark urgently, her voice tight with concern. "These are classic signs of congestive heart failure. She needs to be seen immediately. Honestly, she should still be in the hospital." Mark's response was a polite nod followed by complete inaction. Days passed while Helen's condition visibly deteriorated, her family treating Jessica's medical knowledge like casual suggestions rather than potentially life-saving observations. Then came the moment that crystallized Jessica's frustration. Mark asking ChatGPT about his mother's symptoms and receiving the exact same recommendation Jessica had been making for days. "Go to the doctor immediately," the AI advised, and suddenly the family sprang into action. At the follow-up appointment, Dr. Martinez dismissed Helen's symptoms as minor medication side effects, a response that made Jessica's blood boil. Any competent cardiac specialist should recognize the constellation of symptoms Helen was displaying. Congestive heart failure wasn't some rare complication, it was a predictable progression that required immediate intervention. "He's treating your mother like a template case," Jessica explained to Mark after learning about the doctor's casual dismissal. Good cardiac care means anticipating complications and monitoring for specific warning signs. This is basic stuff. Mark's family remained loyal to Dr. Martinez, citing a friend's recommendation and their reluctance to offend their current physician. Jessica couldn't comprehend prioritizing a doctor's feelings over Helen's rapidly deteriorating health. 3 days later, her worst fears were confirmed. Helen was rushed to the emergency room, gasping for air as fluid filled her lungs. The ER physicians immediately diagnosed congestive heart failure and intubated her to keep her alive, exactly the scenario Jessica had been warning about for over a week, even as Helen lay sedated on a ventilator. Mark's family resisted Jessica's suggestions for seeking a second opinion. Their misplaced loyalty to an incompetent physician nearly cost Helen her life. Yet they continued making excuses for medical care that fell far short of adequate standards. Now, with Helen stable but struggling through recovery, Jessica found herself in the same frustrating pattern. She recommended adding fiber to Helen's diet to address severe constipation, suggested gentle physical therapy for her mobility issues, and identified signs of orthostatic hypotension that were making Helen dizzy and weak. Each suggestion was met with polite dismissal until someone else, ChatGPT, another family member, or eventually a healthcare provider, offered identical advice. The emotional toll was becoming unbearable. Jessica watched the woman she cared about suffer through preventable complications while her boyfriend systematically ignored her medical knowledge. When her recommendations were eventually implemented and proved effective, Mark never acknowledged her initial insights. There were no thank you messages, no recognition that maybe his girlfriend's nursing education had value. Instead, Mark would act surprised when ChatGPT or other sources confirmed Jessica's earlier assessments, as if hearing identical information from different sources somehow made it more credible. The pattern revealed a painful truth: her knowledge was worthless unless validated by external authority figures. Jessica found herself caught between genuine concern for Helen's well-being and growing resentment at being treated like her 4 years of intensive medical education meant nothing. She wasn't asking for gratitude or recognition, she simply wanted her voice to matter when someone's health hung in the balance. The irony was devastating. An artificial intelligence program commanded more respect than a woman with extensive medical training who genuinely cared about the patient's outcome. What do you think about Jessica's situation? Should her nursing knowledge be valued even without a license? Or is Mark justified in seeking other sources? How would you handle being consistently ignored when trying to help someone you care about? Share your thoughts and feelings below. This struggle between knowledge and authority affects so many people trying to help their loved ones navigate medical crises. Share, like, comment, and follow this page for more.